I'm going to present to you today some techniques in order to perhaps minimize some of the trauma that goes into the extraction process. I don't know how you guys were trained in dental school, but when we did our oral surgery rotations and things, it was about getting it quickness. The faster you could do it, then the more talented you were. Well, the issue now is that we are doing these implant-based reconstructions that we need as much of the anatomy intact as possible. So I will tell you right now, the techniques I'm going to show you today are not going to necessarily cut time out of the process for you. They might in some cases, but you have to be prepared that you're using these because of the end goal in mind. So obviously with minimal trauma, we'd like to have an intact alveolar socket, the best healing that we could ask for, ridge preservation if we need to, and then of course subsequent implant placement if we're doing immediate implants in that type of treatment. Now, when it comes to tooth loss, there are certain factors that come into play when we're deciding on removing a tooth, some dental, some medical. On the medical side, certainly diabetes, smoking, different types of those things. Getting into the dental, caries, periodontal disease, preparation for prosthesis, trauma. And as so much of the work that's been done here in Melbourne has been about alveolar remodeling. As we know, as a tooth comes out, we're going to have changes in the alveolus. It's going to alter perhaps where we're going to place our implants, certainly more cost for the patient in many cases in order as we rebuild that anatomy, and we're trying to avoid an unaesthetic result. Most of the remodeling occurs early on in the first few months after the extraction, and the loss of vertical bone height, if left unattended, could be anywhere from 2 millimeters if we're lucky, and maybe a thick phenotype type case.